Start recording, and now I'm going to start admitting people. Okay. Says they're joining. All right, cool. I don't think we have anyone in the waiting room waiting anymore right now. If they do, we will let them enter as they come in. But we are at the top of the hour. I want to say welcome to everyone who is joining us either this morning, afternoon, evening for the Achondroplasia and Skeletal Dysplasia Rare X launch party. We are so excited to have Dr. Ravi Savarirayan here with us. He is a clinical geneticist and group leader of skeletal biology and disease at Murdoch Children's Research Institute in Australia. But before we let Dr. Ravi talk, just to introduce myself, I am Chandler of the Chandler Project. I have achondroplasia. I am a huge advocate for any sort of research surrounding achondroplasia and other skeletal dysplasias. The Chandler Project hosts an annual conference each year that discusses research focused on achondroplasia and other skeletal dysplasias. And so I feel it's very important that, data collection is something that's involved with achondroplasia and skeletal dysplasia during this time that we're in. And so that's my little spiel. Munira, I will let you introduce yourself.
Hi, everybody. Thank you very much for joining us today. I'm Munira Shamim, parent co-founder of Growing Stronger, an organization dedicated to doing research and finding therapeutic remedies for achondroplasia. My husband and I have a 15-year-old with achondroplasia. We always wanted to build community around this rare disease, and your attendance today is testimony to the fact that you believe in building community. The one thing I've always felt with having a child with a rare disease is that patients are the biggest advocates, patients and their families, and also in the realm of data collection, we have to be the loud voices advocating for ourselves and advocating for data collection, because if we don't do this, nobody else will do it for us. I hope you learn a lot from today's session, and I hope you sign up and decide to add your data to the data registry. Thank you.
And so to kick off our launch party, again, we are so excited to have Dr. Ravi here with us. And I think he's going to share just a little bit about the importance of data collection within this achondroplasia skeletal dysplasia community.
Yes, thanks very much, Chandler. And to Munira, thanks for inviting me here. And I think it's a great project. Just a little bit of background on myself. I'm a clinical geneticist and pediatrician. I've been working in the field of rare genetic diseases for 30 years. And my main focus has been on genetic skeletal disorders. And of course, the most common of those is achondroplasia. And about 15 years ago, we started leading the first drug therapy program because, I spent too much time looking after my patients with bad outcomes. And the reason I did this is I said, we've got to have better therapies than just waiting for something to come along and then saying, we're sorry about that. And it's been an incredible journey over the past 15 years. We now have the first medication for achondroplasia vosoritide approved in 46 countries. And based on some very recent data collection, we have now that's approved now from birth in the USA, in Japan, and Australia, and many other countries are going to follow. And now, just for achondroplasia, I'm leading 6 other trials for patients. So someone like Munira's son, I'm hoping by the time he has children that they will have so many options for better health and they won't know what hospital looks like. And I'm sure that's what Munira would like as well. So I think that one of the big things that I deal with, I've just before this meeting, I was on a call with Ipsen, one of the world's largest drug companies. They were trying to work out how they can design better trials. And I said, well, the first thing you can do is listen to patients, because patients have the best questions, and sometimes the patient's questions and what they want doesn't translate necessarily into trial endpoints. So we need to get better at that. And so I think that something like RareX that allows rare patient communities' voices to be heard, to collect data, really not just for sharing with other patients, but with actually sharing with companies who can design better trials, whether it's a drug treatment or a new physiotherapy treatment or a new health intervention or a mental health intervention, it's going to be great. So really excited that Achondroplasia will be joining, and you'll have your own webpage. And I certainly will be going and advocating to my patients here in Australia and around the world that they should join and contribute their data, because in the end, it's really about bringing better health outcomes to our patients. And the closer we can get to that, of course, we need drug companies and we need doctors and we need people like that. But the most important thing is we need the unfiltered voices of our patients to be heard. And I think programs and platforms like RareX, and there are many others around the world, can help that. So, and I see that's part of the vision statement there. So fantastic to be involved and help launch today. I hope you have a great program, and I'm looking forward to being an advocate for the RareX Achondroplasia platform, and certainly be talking to my patients about it as well. And more importantly, I'll be talking to all the companies and other stakeholders that I see, so we can design better trials with better health outcomes for people with achondroplasia, but also for people with all rare diseases, actually. So I think it's a great start. So thank you very much for having me, and I hope the launch goes really well. And again, thanks to Chandler and Munira for inviting me.
Wonderful.
Have a great day.
Thank you so
Ravi.
much, Dr. Ravi.
Bye. Have a great day, everyone. I'm sorry I have to leave, but I actually have to go see a patient on the ward. So let me do that. Thank you.
Thank
Bye.
you.
Thank you.
Awesome. Well, so for anyone on, we have Caitlin and Bridget with us, who are part of the RareX launch, or just part of the RareX team, who will share more about, why this is so important for us to do this and how you can get involved.
Awesome. Thank you, Chandler, and thank you, Munira, for having both Bridget and myself here. And thank you all for joining us. It's so awesome to see how many members of your community are so interested in the data collection program. So I'll just quickly introduce myself. I'm Caitlin. I'm the manager of community engagement here at RareX. RareX is the research program of Global Genes, which is a global advocacy and support organization for the rare disease space. I'll let Bridget quickly introduce herself.
Yeah. Hi, all. I'm Bridget. I am the community support coordinator for RareX. So I work a lot with Caitlin, and I also am that support person that if you have questions about the platform or technological things, you'll be reaching out to me and I can answer those questions.
Great. So I'm going to share my screen real quick, and we're just going to go through a couple quick slides talking about the importance of data collection and how it works. And then we'll walk you through the process of enrolling, and then we'll be able to answer any questions you have. Can you see my screen?
Yes.
Yep.
Great. Awesome. So thank you to the Chandler Project as well as Growing Stronger for having us here today and for joining the RareX data collection program. So RareX, as I mentioned, is a program of Global Genes that was created to accelerate rare disease research and treatments by removing barriers for data collection and sharing. Data collection has been happening for many years, but a lot of times data is held in silos. So typically researchers only have access to certain disease communities, data based off of where the data is collected. And so that's kind of why RareX is here, is to remove those barriers to make sure that all researchers have access to all rare disease data. RareX is a platform to collect, connect, and share the data. So we collect it through your patient communities. We can connect it to additional data sources, and we can share that data with your community as well as researchers and clinicians. It's not a replacement for any current research or clinician-sponsored registry that might currently be happening in your disease space. So why did your leaders choose to go with RareX? RareX is a global data collection platform. So we are compliant in most countries. And if there's a new country that's coming on the platform, we have a whole data governance team that makes sure that the data is being collected in a proper way that's compliant in that country. It's 100% patient owned and managed. So the Chandler Project and Growing Stronger do not own this data. RareX does not own this data. You as the patient own your data. So you have control as to how much data you would like to input, as well as how much data, researchers have access to. There's no cost for you as a patient to join the platform. There's no cost for your organizations as well. There's no cost for researchers or clinicians to access the data either. Our data is in a standardized and structured format, so all of the surveys you'll be answering are in the format that researchers need. We handle all the governance, so we have an IRB that covers your entire disease community, so your organizations don't have to worry about any of that. And then we also have a federated data access platform that the data is then transferred to, where researchers are able to do the most with the data on that platform. Our goal is to speed up research and drug development in all rare diseases, and we have the ability to connect to existing data sources. So what is the benefit for you as a patient, caregiver, or family? We're collecting data on all systems of the body, so this will allow the better understanding of the disease. We return summary data back to your community so you can compare your symptoms with others within your disease space. There is the chance to participate in clinical trials that can come out of this data collection. We have the ability to update any of your symptoms at any time. So this is not a one and done data collection program. We encourage you to come back, as many times as you would like to update your information. And we hope to reach more researchers worldwide, and we have the ability to manage who uses your data. So you have access to say, I only want those involved in medical research to have access to my data, or if you want all general research to have access to your data. So this just outlines kind of your patient journey through the data collection program. So you're coming in through your patient community, so the Chandler Project and Growing Stronger. We've built out a community page that's specific to achondroplasia and other skeletal dysplasias. This will kind of be your front door into the data collection platform. So I'll have Bridget put the link to your page in the chat. So while we're going through the step-by-step process, if you're interested in enrolling simultaneously, you can do so. Anytime you're trying to enroll or log into the data collection program, you will want to use this link. And I believe both the organizations will have it linked on their websites. Once you go through the community page, you'll enroll in the data collection program. You'll go through very standard verification email, setting up passwords, very standard account creation process. And then once that's finished, you'll go through the Matrix terms of use. Matrix is the technology platform that the data collection program is hosted on. And then after that, you'll go through your patient consent and data sharing preferences. And then you'll go into your dashboard where you'll have all of your surveys available. So here's a screenshot of the link that Bridget put in the chat. So this page is specific for your disease community. So at any time you're able to come in and, create your account. So if this is your first time enrolling, which it is for most of you, you'll use this red button here on the left. But once you've created your account and you're just coming back in to complete more surveys or upload, new symptoms or, make any changes to your account that you would like, you'll come and use the button on the right-hand side. So what do you need to get started? Very standard, just an email address and password. Here's a list of our approved browsers. Google Chrome and Microsoft Edge work the best. Apple Safari is still good as well. For the best user experience, try to stay away from Internet Explorer and Mozilla. And what you don't need is you don't need a lot of time. So, coming in and creating your account is one thing, and starting to fill out surveys. Surveys can take anywhere from 2 minutes a survey or 15 minutes a survey. You don't have to do it all at once. You can come and fill out whenever you have time. So once you click on the Get Started button on your community page, it will take you to a first-time login page. So you'll request access. It's really important down here on the bottom to check all that apply. So if you are a caregiver and a patient, you will want to select both. If you are a caregiver enrolling your child or a patient, you will want to just click caregiver here. You won't want to select patient because you'll be able to add the patient at a later time. So once you go through that, you'll receive an account creation email. This will prompt you to create your password. If you don't see this email within a couple minutes, check your junk or spam folder. Sometimes different email inboxes have different kind of security settings, but the email will be coming from RareX. Once you go to create your password, it will make you do a multi-factor for privacy. This will be the only time you have to do this. So when you log in for the next time, you will only have to log in with your email and a password. Once all of that's complete, you'll be able to log into the data collection program. Link down here is our privacy policy. This is the Global Genes privacy policy that kind of outlines how we collect data and how data is stored. And then over on the right-hand side is the terms of use. This is the matrix terms of use, so the technology platform. You can access both documents at any time by clicking on them. So once you log in, you'll be prompted to go through and consent to the matrix terms of use. So this is just talking about the technology platform and how the data is being collected on it. Next, you'll move into the informed consent. So this is 8 pages of detailed Q&A, ensuring that you understand why you're collecting data as well as how the data is being collected. You can click on each different question here and it will kind of expand additional information if you're interested. Part of the informed consent will be asking why you're taking place in this data collection program. So if you are a parent or caregiver of the person who has the rare disease, you'll want to check this box. You can check as many as apply. So if you have stated that you have the rare disease, or if you are the parent, you can select both. You will also, if you're interested in wanting to receive follow-up information about any research studies or clinical trials that kind of come out of this research, us at RareX, we will reach out to you as well as reaching out to your patient organization. So if you're interested in that, I would highly encourage you to select yes. Once you fill out to the informed consent, it will take you to the general information and demographics section. So if you are enrolling as a caregiver, you will be filling out all of this information as the caregiver because you will do so as the patient once we add the patient. We'll get to that in a couple of slides, but just note that if you're the caregiver, you are filling out this first part as the caregiver. So this area will just kind of ask just general demographics, you know, where you live, what your household income is, what type of healthcare you have. And then down at the bottom, it will ask for the rare disease. So if you are the caregiver, it will not ask for your rare disease, but once you are filling this out as the patient, you will be able to select the rare disease in the dropdown. You will see achondroplasia in the dropdown as well as skeletal dysplasias, not achondroplasia. So if you have other skeletal dysplasias that are not achondroplasia, you will want to select that. Moving through, you will see the data sharing preference agreement that you can consent. This is where you really control your data. Who do you want to have access to the data that you're submitting in this data collection program? So the first option is general research. So this will have your data available to the most amount of researchers as possible. The second option is for strictly only health, medical, and biomedical research. So that just makes it a little more limited who has access to the data, but you are encouraged to put whatever you are comfortable with. You are able to put other limits and restrictions on who has access to your data. So the first option is for research solely for non-commercial purposes, and then the other is research that has been approved by an IRB. So we have a whole application process that researchers have to go through to access the data. It's a very standard process. Most researchers will have gone through that no matter what data they're accessing. Once that application is turned into RareX, we do have a review board that goes through and looks at each application. And this is kind of where this restriction comes into place, where we're able to separate the data that, you know, only wants to be approved for IRB purposes. If you have any biological samples that you've given for research purposes, you'll want to note that here. And if you're interested in collecting any biological samples from RareX, once this is available, you'll select yes here. If you are interested in having your contact information shared with Chandler and Manira, Contact information is just first name, last name, and email. All data that is submitted through this data collection program is de-identified data. So it's de-identified data that's returned to your community as well as to researchers. The only identifiable data is the contact, and they are not able to connect that back to the data that is put into the platform. Both Chandler and Munira will be going through data and ethics training with RareX to make sure that when they're accessing the data, they're doing it in an ethical way. But if you are interested in sharing your contact information for, additional support and advocacy reasons, for conferences, stuff like that, you can select yes here. If you would like your data summarized on a data dashboard for the leaders, so they can see like an overview of, some of the most commonly reported symptoms and like demographics for the community, you can select yes here. So once you've gone through that as the caregiver, you are able to add a patient. So over on the left-hand side here, you'll see a blue button that says add patient. You'll click on that and you will go through the same process of the informed consent and demographics, general information, as well as data sharing preferences for the patient. When you're looking at your dashboard to figure out whether you're in the caregiver or patient mode, you will want to look in the left-hand corner. Whoever you're viewing, so for example, we're viewing Macy. Macy is who you'll be filling out the surveys for. Once all of the informed consent and general information is complete, you'll be able to start filling out surveys. If there's one survey you're ever to fill out, it's the head to toe survey. So this is the main survey that kind of triggers all of the level 2 surveys. So this survey will ask about symptoms from your head to your toe. And for every yes or unsure, we'll then trigger level 2 questions that go more in depth into that symptom. Over on the right-hand side here, you'll be able to see how many questions are on each survey, as well as time to complete. The time to complete are very kind of generous timeframes. It should take a lot less than that. So don't get discouraged when you see the time. Here's an example of some questions that are on the head to toe survey. So have you had issues with eyes or vision? If you select yes, then you'll go back to your dashboard and you will see additional eye and vision surveys. If you answer no, then you won't receive any additional surveys on those specific symptoms. In the head to toe survey, it will ask about genetic testing information. If you have genetic testing, you will want to say yes, and then you'll say what the reason for the genetic testing. And if you have your report or summary, you are able to upload it onto the platform. So once you're out of the survey, you'll go over on the left-hand side. The dashboard is where you see all of your surveys. Under documents, this is where you can upload your genetic report. So you'll go to documents. You'll then click upload, you'll tag it as a genetic test, and then it typically takes about a minute or two to upload, and you'll be able to see the genetic test uploaded here. It's also a great place to just kind of have it stored because it will stay there until you remove it. Here's a quick example of some of the level 2 surveys that you might see on your dashboard. Based off of how you answer your head to toe, the surveys will vary for the level 2. So for example, someone clearly had mentioned in head to toe, they had behavior issues as well as bone and cartilage, brain and nervous system, digestive, ears and hearing. And then each level 2 kind of goes into a deep dive of those specific symptoms. So for this is an eye and vision level 2. So, eye movement issues. Do you see this symptom? When did it first appear? And what was the age of diagnosis? It goes a deep dive into each specific symptom. At the bottom of level 2 surveys, there is a please describe box. So if there are any specific symptoms that you weren't listed on here, please feel free to add any and all information, but please try not to put any identifying information. You can use your disease name, but just try not to use the patient's name or the patient's gender in the box. We do have a team that's able to go and remove that, but it's just the easiest way to keep all the data de-identified. If the violence survey is applicable to your community, it will show up in your dashboard. This is by far our longest survey. And just a quick note that if you are filling it out for the first time, you will need to complete it within the first 30 days. Once 30 days is up and you've only completed half of it, it will restart it back to the beginning. So if you have any questions around this, you can email our team and we can tell you when it was first started. Once you go through and complete some surveys, you will see them in the completed tab appear on your dashboard. So you can access all your surveys at any time. You can refill them out, you can view them, you can take them into your doctor's offices by downloading them. You can do whatever you would like with them. As new surveys come available, they will show up in your new and in progress tab. And you will also be notified by the data collection program of new surveys. If you have any questions or any technical issues along the way, as Bridget mentioned, we have a support line here. We'll put the email in the chat for you. So if any questions ever come up, we're happy to walk you through the process or give you a little more detail as to why, you're receiving that survey on your dashboard. And any questions I can answer.
I did have someone message, but I just want to confirm or hopefully Caitlin and Bridget, you can confirm for anyone maybe who's on here outside of the US, this is available internationally.
Yes. Yep. So right now, the platform is only available in English. So it is open to anyone globally, but right now it is only in English. So if you understand English and can consent in English, you can take it. We will be releasing some additional translations in the next few months. So stay tuned for that.
Wonderful, thank you. If there's anyone who has questions, we are happy to answer and hope, this was a very informative session for everyone. All right, I'm going to take that as maybe no questions, which is totally fine. But this was recorded and we will have this both on the Chandler Project and Growing Stronger's. Oh, someone asked, can you please talk about the chances for trial? So I don't know.
Yeah, that's a great question. And honestly, that's probably a better question for a researcher. But by collecting all this data, our ultimate goal is clinical trials as well as treatments. So the more data that is entered into the data collection program, the more researchers will have access to it and the potential for clinical trials will come out of it.
Yeah, but and at the same time, I'd like to clarify that RareX is not the means for enrollment in a clinical trial.
Correct.
So if someone is looking to enroll, they would have to, I think the best place is to go to NIH.gov and look at their clinical trial information and then find a site that's closest to where you are located. What we're doing with RareX over here is generating enough information to create momentum around clinical trials. So the more data we give, the more trials we will see down the road.
I think that's it. Sorry, I had a few direct messages, but I don't think they were real questions. But yeah, and again, if anyone has questions for RareX, the email is rarexsupport@globalgenes.org. And when we share this video, we will be sure to include that listed, anywhere that we post this. But other than that, thank you, Caitlin and Bridget, so much for sharing this with us this evening. And hopefully, this will be a great thing for our community.
Great. Thank you so much for having us. And thank you all for joining.
Thank you, everybody.
Thanks all.